Hello guys, I'm so excited that I finally have just received my new book, which is Training, Nutrition, Supplementation in Bodybuilding. You can purchase this book on Amazon. In this book, you're going to find basics regarding how to eat, how to work out, and what supplements to use in bodybuilding, and along with my other book, which is already available, The Good, the Bad, and the Ugly, actually speaks about drug use, which is the improved version of my very first book, The Peds Used in Sports. Somebody has the whole package of knowledge in order to fulfill his targets. Thank you so far for the positive feedback and the good comments, and I hope you do like it.
Hey everybody, welcome to Ask Testosterone, starring Dr. George Tulianos, brought to you by his book, the original book, Body, the Good, the Bad, and the Ugly. It's a great overview, especially of the PED side of the sport, and his most recent work, written during the quarantine, Training, Nutrition, Supplementation in Bodybuilding, which gives you more of an overview of the training and nutrition and obviously supplement aspects. So you put all those things together and you get the best results possible. Both available on Amazon.com. Now, from Athens, Greece, welcome, Dr. George Tulianos. Welcome, Doctor.
Hi, Ron. Thank you for the intro. Today we have a special, a special thing. My gift to the audience is those who listen to the shows is a quiz. Yeah. So I made out a quiz of 15 Q&A, and in order to pass for the students, they need 10 out of 15.
That's fair.
About 65%, yes.
And so I say, if you don't get at least 10 right and you haven't used steroids yet, you can't use them yet. You got to wait.
You should read the book again, yes.
Read the book again. Get it. I always tell people that I'm not anti-steroid, I'm not pro-steroid, but you need to know what you're doing. These are very powerful compounds that can change the chemistry of your body, literally. So,
I was consulting a guy. I was consulting a guy, a potential patient, but actually is a client, and he wanted to ask me about what's the best cycle. So I asked him, what was your last cycle you had? He said 2 years ago. What was your PCT? He goes, what is PCT? So you don't know the alphabet. Are you supposed then to speak languages?
Yeah.
Doesn't work this way, You need the basic. You need to know anything.
Right.
Don't play with the fire, Otherwise you'll get burned.
I think you've also said it. You're just learning how to drive. You probably shouldn't be behind the wheel of a Lamborghini if you're just learning how to drive.
Yes.
All right. So without further ado, this is the PED quiz prepared for you by Dr. Tulianos. Let's see how you guys do. Question number 1. Which is the most toxic 17-alkylated anabolic androgenic steroid? OXANDROLONE, OXYMETHOLONE, METHYLTRIENOLONE, FLUOXYMESTERONE, or STANOZOLOL? Think about it, guys. Again, OXANDROLONE, also known as Anavar, OXYMETHOLONE, which is Anadrol, METHYLTRIENOLONE, is that Primobolan?
M3,
methyltrianolone. And FLUOXYMESTERONE is halotestin?
Yes. And
STANOZOLOL, obviously Winstrol. So what do you guys think? Most toxic out of all those? Answer is methyltrianolone, M3.
Yes, M3. And as Bill Welling analyzes in the Anabolics book, it's a derivative of Trenbolone, and actually is really potent 17-alkylated steroid that comes in 1 milligram tablet. Can you guess how strong it is? So 1 milligram tablet only, like an astrozole, for instance.
How strong it is?
It is very strong to the liver, very toxic to the liver.
If it's only if it's only 1 milligram, because these other ones come in doses typically anywhere from 10 to 50 milligrams.
1 milligram, otherwise it will kill your liver,
I've never even heard of this. And who uses M3? I've never even heard of this stuff.
Well, track athletes, Olympic weightlifters, Okay. Also swimmers, I heard, endurance swimming. But also many guys pre-contest, if they don't have halotestin, they use M3. It's really androgenic also, that gives you strength during dieting. Yeah. But it's very toxic to the liver. And actually, Llewellyn describes that 2 milligrams in 1 month is able to give you cirrhosis.
Oh my God.
Jaundice, you know?
2 pills?
Yeah, 2 pills in 30 days, yes.
Yeah. How much
Can
you want to bet?
process?
I bet you a bunch of guys watching us are texting their dealer right now saying, bro, can you get me some M3? This stuff sounds really good.
So M3 and vodka can give you liver transplant, you know?
Instant liver explosion. Okay. Question number 2. Which anabolic androgenic steroid has the lowest androgenic index? Androgenic index. Stanozolol, oxandrolone, methenolone, that's primobolan. Nandrolone, deca, oxymetholone, anavar. So the question, again, which anabolic androgenic steroid has the lowest androgenic index? So the choices again, stanozolol, oxandrolone, methenolone, nandrolone, and oxymetholone.
So in other words, which is the least androgenic?
Least androgenic. The answer is oxandrolone or Anavar.
Anavar, yes. That's why it's preferable for women. Not that it's not toxic to the liver or to the lipid, but it has the less androgenicity, leading to hirsutism or virilization effects. Yeah. But progressively, in the long term, the androgenic effect will accumulate, and then eventually we may deepen in the voice of a user, you know? Female user, of course.
Yeah. Well.
So don't be fooled that no matter what Anavar won't have you side effects. So 20 milligrams in 30 days may stop your menstrual cycle. 10 milligrams in 30 days may not. So it's dose dependent and time dependent also.
Yeah. And as you point out, all of these 17 alkylated steroids, they're liver toxic over time. So
all of them.
There's no free ride, guys. There's no free lunch, as we say. Next one. Which anabolic androgenic steroid is not DHT derivative? Not DHT derivative. Your choices are oxandrolone, stanozolol, methenolone, nandrolone, and mesterolone. Not a DHT derivative, oxandrolone, stanozolol, methenolone, nandrolone, mesterolone. Answer is nandrolone or decadurabolone.
Deca, yes.
Not
so actually, all of them are DHT derivatives except from Deca. So it's kind of tricky, the questions, you know.
Yeah.
You have to know really good in order to avoid the tricky parts.
Gotcha. Okay. Here's a, boy, EPO release. EPO is,
erythropoietin.
What is it?
Erythropoietin.
What is that exactly?
That elevates your red blood cells and your stamina, you know, endurance.
Okay, good. Because the next question is, which is the stimulus for EPO release? Hypoxia? What's hypoxia?
Low oxygen saturation, you know. When you go up hills, up to in the top of the mountain, you know, there's the air is very thin. It's low oxygen saturation, unlike the sea level.
Okay. And OSA, that's another choice.
Obstructive sleep apnea. When you snore and you choke.
Yeah, I do that.
You choke in your sleep and you wake up abruptly. You know what's going on?
Yeah.
This is also another stimulus.
Smoking, anabolic androgenic steroids, and high altitude. So which are the stimulus for EPO release? Your questions are, or your options are hypoxia, obstructive sleep apnea, smoking, AAS, and high altitude. Answer is all of them. All of these.
Yeah, all of them. So there are two basic stimulus, steroids and low oxygen. Low oxygen will stimulate EPO from the kidneys, and steroids also stimulate EPO from the kidneys because they treat anemia.
Okay.
So if you go up hills, smoke, have OSA, and do steroids, you're going to blow your hematocrit.
Oh, geez. Wow, that's, I know that guy. I mean, well, if you live there, there's high altitude places like Denver, Colorado, where the oxygen saturation is a lot less. Here's a great question, guys. You guys need to know this answer. Number 5, which are the 3 most dangerous PEDs? So PEDs encompasses all the drugs, guys. It's not just steroids. It's all the different drugs that are used.
Yes.
Okay, so the 3 most dangerous. So your options are, you can pick 3, AAS, anabolic androgenic steroids, insulin, EPO, diuretics, stimulants. 3 most out of those 5. AAS, insulin, EPO, diuretics, stimulants. Answer is diuretics, instant death can happen. Insulin, instant death can happen. Stimulants, instant death can happen.
Yes.
Boom, heart attack. Wow.
Yeah. So diuretics, it's hypovolemia, hypotension, and ventricular fibrillation. Then the insulin is hypoglycemic coma and death. And the stimulus is stroke from systolic blood pressure and rupture of aneurysm, and also myocardial infarction from vasoconstriction in coronary arteries. So they can kill you in a heartbeat. Progressively, steroids will, in 20 years perhaps, will give you heart issues or liver issues, most common. And EPO, yes, EPO progressively may give you some stroke, perhaps, yes, if you are dehydrated also.
But insulin, diuretics,
yes, don't fool around with these three.
I mean, we've both known people that died from insulin and diuretics.
I'll give you an example about stimulants. If you sniff too much of cocaine, you'll die of a stroke or a heart attack. So it's the same. It's a stimulant also, cocaine.
Right.
And actually, it's anesthetic to surgery, but it's a stimulant also, yes.
Yeah. I think long ago in America, dentists used to use cocaine to numb the gums. Yeah. Which is why a lot of people, cokeheads, will do that with their gums.
Yeah, the
cups.
Put
a little bit on. Okay, GH, guys. Next question is about growth hormone. What is growth hormone responsible for? Is it lipogenesis, which is fat burning?
Storage.
Storage.
Yes.
Okay, I screwed that one up. Lipogenesis, fat storage, beta oxidation, diabetes. Yeah, the opposite. Okay. Diabetes mellitus 2, glycogen synthesis, or glycogenolysis. What is glycogenolysis?
It's the opposite of glycogen synthesis.
Okay, so it'd be taking glycogen. Okay, so guys, which one of these? You can only pick one. Oh no, you can pick several apparently. Lipogenesis, beta oxidation, diabetes mellitus 2, glycogen synthesis, or glycogenolysis. Answer is beta oxidation, fat burning / lipolysis, diabetes mellitus 2, oh boy, and glycogenolysis.
Yeah, so actually growth hormone works in a different way, antagonistic way than insulin. So insulin promotes glycogen synthesis through the enzyme glucogen synthase enzyme, while GH releases glucose into the bloodstream from the liver, leading to hyperglycemia and diabetes. So if you don't burn this glucose, you're going to become diabetic. It's insulin resistant. That's why in order to compensate this, they use also insulin along with GH to balance the blood sugar,
Yeah, doctor, you've known a lot of people, maybe even patients who have used growth hormone. How many of them have you encountered that did develop diabetes mellitus from using growth?
I know 2 professionals already that had, yes.
Wow, that's scary. So they need to take insulin for the rest of their lives every day?
I think it's type 2. It can be reversed.
Okay.
So, but they were in a diabetic state when they were fasted. Their serum glucose was over 120. So this was the result of excessive and prolonged GH.
Yeah.
All right. And perhaps if you eat too much of sugars, blah blah blah, you don't watch out your fasting blood glucose, then it becomes trouble, but it can be reversed.
Okay, cool. Now we turn to insulin. What is insulin responsible for? Is it fat storage, glycogenolysis, muscle growth, glycogen synthesis, or lipolysis? What is insulin responsible for? One more time. Is it fat storage, glycogenolysis, muscle growth, glycogen synthesis, or lipolysis? Answer is lipogenesis, or fat storage, muscle growth, that's good, and glycogen synthesis.
So glycogen synthesis, we said, it fuels up your muscles. You feel pumped and jacked with insulin. Is the glycogen synthase enzyme, the opposite that what GH does. Also, through the mTOR, it's anabolic hormone. So it does not only nourishes the muscle, but also promotes muscle growth through mTOR. There are pumpkin, but also leucine, for instance, kicks mTOR. And then also it's fat storage. And in the fat storage, we're not speaking about only subcutaneously, because diabetes type 1 patients, they are born with diabetes. They develop spot lumps, some lumps where they inject the insulin. Now, bodybuilders abuse insulin and eat tons of food, and they create the visceral fat, which is hidden inside the abdominal cavity. Yes.
I got some of that.
Okay, this is how the bubble gut is created.
Wow. So, question, doctor: growth hormone burns fat. Insulin makes you store fat.
Yes.
Since most of these guys take both of them at the same time, do they cancel each other out in that regard?
Yes, in a way, yes. So if you use only steroids and insulin, most likely, if you use off-season steroids, you become bloated and fat.
Oh boy!
So you need GH to compensate.
Nice.
You know.
Yeah. Next question is about stimulants. Which stimulants are psychotropic? How would you define psychotropic?
Psychotropic is highly addictive. You know.
Oh, okay. So, which stimulants are highly addictive or psychotropic? Ephedrine HCl, clenbuterol HCl, thyroxine, amphetamines, or yohimbine HCl. Okay, so ephedrine, clenbuterol, thyroxine. Thyroxine would be a
T4
thyroid hormone, yeah, T4.
Yes.
Amphetamines, obviously, we know what those are, and yohimbine, which you wouldn't think of as, I wouldn't even think of as a stimulant. The answer is amphetamines and ephedrine HCl.
Yes, amphetamines, big time. The cops use amphetamines, the students use amphetamines, the lawyers perhaps use amphetamines, the doctors use amphetamines, you know, in order to stay up or to have, you know, to be very verbally, how you say, fluent, you know.
Yeah.
The Formula One driver, perhaps they can use some players for extra time in order not to feel fatigue, you know. But also ephedrine. If you cut ephedrine cold turkey, you're gonna yawn and sleep for the rest of the day, you know.
Oh man.
It's highly addictive when it's combined, especially to caffeine. But ephedrine is considered a pre-narcotic substance in Greece, you know.
So
a precursor of narcotics.
Can you buy ephedrine in Greece, or is it illegal?
You could buy it 20 years ago as a nasal spray, you know, for congestion.
Yeah.
But it was not available in pills like in Spain or in Turkey.
Gotcha. Yeah. Yeah, we can still find it in asthma, over the counter, you know, like asthma medications here.
Once I had a brief relationship with a dentist. She was a coke addict.
Oh boy.
She was a party animal, but she was a coke addict also. She ran out of coke and she was begging me to give her some ephedrine to wake up, you know.
Oh man.
Yeah.
Sounds like a fun girl though. Hey. Okay.
Now she takes care of my teeth, you know.
Oh, okay. Well, so she's still practicing dentistry. That's good. All right. Question number 9. Which are the medical indications of PEDs use? So what were these things guys actually developed for? Not to get you big and jacked. They were developed for, is it anemia, osteoporosis, cachexia, which is muscle wasting syndrome, right? Dwarfism, or diabetes. So were steroids developed for, or PEDs, anemia, osteoporosis?
No, actually steroids, because PEDs are also other substances. So
yeah, this should
AAS mainly.
Do a little edit on that. Okay. So the answer is osteoporosis, or bone fractures, cachexia, muscle wasting. That's what steroids were actually designed for.
And anemia also.
Oh, anemia. Okay.
And anemia, yes. But not for dwarfism, because GH was made for that.
Yeah.
And IGF-1 also. And the last one is
diabetes.
Diabetes, no. Insulin is responsible for this.
Okay. Now, number 10. What are the side effects of AAS use? Guys, you definitely want to know this before you use steroids, because you're going to get some of these, or all of them. Elevated blood pressure, hypertension, deep venous thrombosis, DVT, which can be very serious. That's what led to Flex Wheeler's lower leg being amputated late last year. Pulmonary embolism, PE, which can be instantly fatal. That's a blockage in your lungs, right? Cardiovascular disease, CVD. Hypoglycemia, which is low blood sugar, right? Hypoglycemia. So yes. What are the side effects? Is it elevated blood pressure, deep venous thrombosis, pulmonary embolism, cardiovascular disease, or hypoglycemia? Answer: elevated blood pressure or hypertension, deep venous thrombosis, pulmonary embolism, cardiovascular disease. So it's everything there except for hypoglycemia.
And actually, pulmonary embolism can happen if you inject abruptly with some air inside, air bubble inside the oil injection, you know?
Yeah.
It's unlikely to happen. It's rare, but it can happen. And deep venous thrombosis also, yes. It may lead to pulmonary embolism in some extreme cases, you know?
Yeah.
So the embolus may travel up to the pulmonary arteries, you know? And start choking and coughing severely.
If you inject your gear into a vein by accident and it goes into your bloodstream, could that immediately be a pulmonary embolism?
A fat embolism mainly. A fat embolism.
Okay.
But the pulmonary embolism mainly happens from air bubbles, you know?
So that's a good question because, you know, people, we try to get all the air out, but
you have to take off everything, even spill it, you know, 0.1 ml. Don't be sorry about this.
Yeah, you can't spill steroids though. So what are you going to do? Can't waste
You're going to regret it afterwards, you know, you start choking and coughing.
So any amount of air in the syringe is very, very bad.
Oh, absolutely, yes.
I was thought maybe a little bit's okay. It's all right. All right, well, I'm learning too. Here we go. Next one is, what are the side effects of GH, growth hormone use? Is it elevated blood pressure, hypertension, carpal tunnel syndrome, lower mandible protrude? Oh boy, get a nice strong jaw.
Frankenstein jaws.
The chicks dig those big lantern jaws though. Diabetes mellitus 2 or hypoglycemia. So what are the side effects of GH? Elevated blood pressure, carpal tunnel syndrome, lower mandible protrusion, diabetes mellitus, or hypoglycemia? The answer is carpal tunnel syndrome, lower mandible protrusion, and diabetes mellitus 2. Wow.
So how is explained the carpal tunnel? We know that GH leads to edema, which is, you know, swelling.
Yeah.
Now, in the wrist, we have 4 tendons, superficial, and 4 deep tendons, like sandwich.
Yeah.
And between them lies the median nerve. The median nerve is responsible to move the wrist, okay?
Yeah.
So we have the 4 tendons and the upper and the lower, like this. Now the tendons are covered by sheaths, like current cables, you know?
Yeah.
When the sheaths, they develop edema, they compress the median nerve, you know? And then you have numbing here, you know?
Yeah.
And then you have to do a surgical procedure and cut here the transverse ligament in order to decompress the median nerve, you know? Sometimes if I inject a lot of pharmaceutical GH, my wrist look like a pancake, you know?
When you say a lot, what's a lot?
6.
Okay.
Pharma grade, yes, 6.
So I mean,
I feel it, you know, but after 3-4 days, if I stop it, then I become less bloated, you know? As I told you the other time, I have bigger arms.
Yeah, I mean, that's a bonus.
And my wrists are really thicker, you know. You can realize it.
Do you get the water retention in your face?
Yes, a little bit also. Now about the lower mandible, the jaw protrusion is the acromegaly result, because after the closure of the epiphyseal plates after 18, we have the elbows, the cheekbones, the forehead that widens, and the lower mandible that protrudes.
Yeah.
But I guess in the long term, you know.
Yeah, I mean, you see on people who abuse growth hormone over many years, you see a lot of the same things. You see the pointy elbows, like out to here. You do see the bigger jaw. I see like a bigger brow ridge, like
the forehead, yes, and the cheekbones, especially when you diet, they yeah.
And I don't know if this is possible, but it seems to me like their noses get fatter too.
Yeah, the nose and the ears and the tongue, all the soft tissues.
Yeah,
all the soft.
They kind of all, I don't want to offend anybody, but in the same way that
they develop, yes, everything develops.
Down syndrome has a very specific look to the face. People, you know, children that are born with Down syndrome, and people that abuse growth hormone over many years, they have a very similar look. They all look like they could be cousins or something. It's creepy. Anyway, all right, let's move on with the quiz. Number 12. What is a safe insulin protocol for a 70-kilogram man, which would be about 150 pounds, guys?
155, yes.
155. We're in the metric system over there in Europe. So, 70-kilogram man, would it be 11 IUs and 110 grams of carbs, 10 IUs and 1,000 grams of carbs?
Oh, I'm sorry, 100. I'm sorry, 100.
Oh, I thought you were trying to really fool us on that one.
Yeah.
9 IUs or 90 grams carbs, 8 IUs or 80 grams of carbs, or 7 IUs and 70 grams of carbs for a 70 kilogram man. What is the answer? 7 and 7.
Yes.
7
So
IUs.
roughly it's 10 times your body weight in kilograms.
Yeah.
And also, I'm sorry. No, it's 1/10 of your body weight in IUs, and your body weight in grams of carbs, in kilograms.
It's important to note, especially for you people in the UK and the USA, he's talking about kilograms. So you don't want to, if you're a 220-pound guy, you do not want to be doing 220 IUs of insulin a day.
Make sure the carbs are 50-50, 50 complex, 50 simple. Okay?
Like, what's a good mix if you were doing it post-workout?
So maltodextrin, for instance, along with starchy carbs. So food and solution also.
Gotcha. Okay.
But also prepare your creatine, your glutamine, your leucine, your EFAs, your vitamins in order everything to influx into the cell, you know?
So it's a big post-workout.
It's the anabolic window.
Some protein in it. I guess the EEAs would take care of it.
Absolutely. Amino acids and the food stuff, of course.
Gotcha. Next one is, which AAS, which anabolic androgenic steroid is known to block aldosterone, which is a hormone responsible. What is aldosterone?
Aldosterone is a hormone released by kidneys responsible for sodium and water retention. Okay. So actually, due to aldosterone, we elevate blood pressure through steroids, through testosterone, you know, and it is also a fundamental way how muscle growth occurs. I mean, how swelling of the muscles, because muscles consist 70% of water. Now, when we inject steroids or when we take creatine, but through another mechanism, muscles start to swell and, filled up with water. This water environment becomes anabolic, all the nutrients.
Yeah.
Okay.
So the question is, oh, geez, I lost it. There we go. So which one is going to block aldosterone? Your choices are OXANDROLONE, Anavar, OXYMETHOLONE, Anadrol, NANDROLONE, Deca, STANOZOLOL, Winstrol, Trenbolone. You guys all know Tren. So which one blocks aldosterone? Is it OXANDROLONE, OXYMETHOLONE, NANDROLONE, STANOZOLOL, or Trenbolone? Answer is STANOZOLOL or Winstrol.
So let me rephrase this to a less tricky way because my questions are tricky. Okay. So
supposed to be.
All steroids, I'll rephrase. All steroids stimulate aldosterone with the exemption of Winstrol. And this is the good thing about Winstrol, but the bad thing also has a flip side. So the good thing is that Winstrol does not stimulate aldosterone, so it's the ideal drug to use pre-contest with zero water retention. Zero. Okay, to the subcutaneous. On the other hand, if you don't stimulate aldosterone, you don't have blood pressure elevation, but you don't stimulate water retention into the synovial cavities in the joints. Therefore, your lack of lubrication, and sometimes when you lift heavily, low-fat diet, because fat also lubricates the joints, then it's more likely to happen tendon ruptures. They get toasted, they burn out.
Yeah. Do you think that that's a large reason? A lot of guys do tear muscles in prep. It's probably because a lot of them are on Winstrol during prep, and they're dehydrated.
A good idea is to use 50 milligrams of Deca to rush some fluid into the joints,
Okay. All right. Now, name the least anabolic of the steroids, AAS. The least anabolic. Is it boldenone or equipoise, oxandrolone, Anavar, METHYLTRIENOLONE, that's primobolan, METHYLTRIENOLONE?
Yes.
OXYMETHOLONE, Anadrol, or NANDROLONE? What's the least anabolic, guys? Boldenone, oxandrolone, METHYLTRIENOLONE, OXYMETHOLONE, or NANDROLONE? Answer is METHYLTRIENOLONE, primobolan, is the least.
Yes.
Wow. I thought that was pretty
But actually, it's safe also because it's the only oral and injectable, which is not inoculated. So you could take primobolan oral and have no liver issues like Proviron, for instance. But it's, it's not a strong anabolic. You need at least 600 milligrams to notice anticatabolic effect, Yeah. So it's less anabolic than Deca, than equipoise, than testosterone. Yeah. It's very expensive. You don't have to care about estrogens, but also it's not so anabolic.
Yeah, I mean, very, very popular in the final weeks leading up to a competition. You know, I've never heard of anybody using Primabol in the off season. What a waste that would be. Okay, guys, our final question on this PED quiz from the doctor. Which stimulant is used for nasal congestion, stuffed up nose? Is it clenbuterol HCl, yohimbine HCl, ephedrine HCl, or caffeine? Which one? Answer is ephedrine HCl is used.
Yeah, we said that before. So what is nasal congestion when you have a running nose? So it's the mucus that's the result of the blood vessels, you know, that they produce mucus. Now, when you use ephedrine, ephedrine causes vasoconstriction, which is narrowing of the peripheral arteries. Yeah. So it works like cocaine, you know, you have vasoconstriction in the nose, you know, and it stops production of mucus. On the other hand, also, if you take ephedrine, you cannot masturbate and you cannot have sex.
Why
because
not?
the penis works through vasodilation, you know, so it's not a good idea. It's not a good idea. You need the opposite.
So ephedrine is probably worse for your penis than Deca. This sounds horrible.
It constricts. Also, cocaine is not good. I mean, for a guy, for a woman, it's all right. She doesn't feel any pain, but for a guy, it's not good. You know, to have a good hard-on with coke.
You know, the great thing about being, I'm not a woman, obviously, but I think the great thing is pretty much all their issues can be solved with lubricant. You know, just, you know, if they can't lubricate, but the guys obviously have a lot more mechanical things to worry about.
Well, women have a small penis, you know, that it can be enlarged with some steroids, you know.
Yeah, I've seen pictures, of course, never in person, of course. But yeah, I've seen some that are about, I want to say about this big.
Like your pinky?
About, almost, yeah. Yeah. Maybe my thumb. Yeah.
Really?
You know, I don't have the biggest fingers, so yeah, it's feasible. Anyway.
Some men enjoy it, you know.
It's easier to stimulate something that big, wouldn't you think?
Lollipop, eh?
Yeah. All right. Well, that's it, guys. That is your PED quiz.
Was it hard, huh? Was it hard? Hard, yes.
We always end up talking about that. So, guys, check your scores. I hope you were playing along, and if you got at least 10 out of 15 right, you're pretty knowledgeable about all these things. The doctor did try to trip you up. Some of the questions are worded a little tricky, but we can't make it easy. If you make it easy, you get them all correct, you know, and that would be no fun either.
We can have more quizzes if they like it, yes. If they enjoy failing.
I mean, give us some ideas on some things you'd like to see here, because we do Q&As all the time, but every once in a while we like to mix things up, make it a little more interesting. This was a good idea, Doctor.
This is fascinating, and Thomas liked it also, you know.
Did you send him a copy?
Yes, of course, yes.
I hope he got them all correct. He better, or we're going to take his testosteronology license away. No, I couldn't do that. All right. Well, Doctor, thank you so much. That was a very entertaining episode, very different take on the normal Ask Dr. T. And that's it, guys. Remember to check out every Tuesday on Muscular Development is Dr. T Tuesdays. That's when we post these videos on musculardevelopment.com and on our YouTube channel. And we get a new article by the doctor. I won't ask you what, because we're actually recording this a little bit ahead of time.
Yeah, but, so the next one will be about the common injuries and dehydration in bodybuilding.
Yeah, see, guys, we're covering everything, not just drugs, training. We got everything in there. All right. Well, thank you so much, Doctor. Appreciate you taking the time, sharing your knowledge and expertise with people over the world who really seem to need it and enjoy it and appreciate it. They're giving you a lot of love in the comment sections. So, guys, if you have questions for the doctor for a future episode, please leave them in the YouTube comments, and we'll get to them. We're probably going to have to start being a little more selective and just pick maybe the most interesting ones or the ones we think would help the most people, because sometimes we get a lot
76 episodes, eh?
Yeah, this is number 76.
Almost 800 questions, huh?
It's a lot. Yeah, it's a lot, man. Eventually you'll hit 1,000. Then you get a mug. Anyway, that's it. Thanks, guys, for watching Ask Dr. Testosterone. Remember to check out his books on Amazon.com, Bodybuilding, the Good, the Bad, and the Ugly, and the newest one, Training, Nutrition, Supplementation in Bodybuilding, both by Dr. George, both very informative. And thanks for watching, everybody. We'll see you next time.